Hi friends, welcome back to my channel Sharing Simple Knowledge. Today I am going to discuss about a case note. This letter is we are going to write. Here the reader is the psychiatrist because one of my viewers keeps on asking to post this letter. That's why I am making this video. So let's look into the details. So the writing subtest is for the nursing, time allowed, reading time 5 minutes and the writing time is 40 minutes. So the total allocated time is 45 minutes. So you are a charge nurse in Good Shepherd Hospital. Miss Elizabeth is a patient in your care. The patient name Miss Elizabeth, age 75 years. So we understood our position is a charge nurse where in Good Shepherd Hospital and patient name is Elizabeth and age is 75 years. And next we are going to write this letter to a psychiatrist. So we have to see what all information we have to take from this case note and to include in this letter. So let's read the medical history. She has hypertension for 10 years, diabetes type 2 since 2000, insulin human ectopid 16 unit and 18 unit, that is BD. So then next BPAD, that bipolar affective disorder, diagnosed at the age of 30. Medication non-compliance noted. That means she was not taking medication properly on time. Treated with ECT, electroconvulsive therapy on medication. Failed suicidal attempt at the age of 42 years. History of chickenpox at childhood. Hospitalization, food poisoning before 5 years. Childhood, inferior, introverted, hesitant to go school. Gained weight 5 kg over 2 months recently. So we should see what information we have to include, which is relevant for a psychiatrist. Just assume you are a psychiatrist and you should think what all information I should know to provide the care for this patient, for the treatment for the patient. Should I know the old chicken pox? No need. So whatever related to him only we have to include. Other things should be omitted. That means irrelevant information should not include in this letter. If you include all these things, the word count will be more than 200 and they will reduce your score. Next, we are going to move to this social history. She is a widow, lives in Victoria nursing home. Daughter Mazia lives with husband, settled abroad. Recently quit smoking. BMI 30, food preference, junk food, cheese, spicy, red meat, sweets. Son, Down syndrome. He is in a rehabilitation center. Diagnosed with myocardial infarction. Mother died due to diabetic food. No other social involvement. So from here also we have to see which all information I have to inform him. Next is grandfather passed away due to severe depression. Then the present complaints. On 4/7/2019, she fell from upstairs, complained severe pain and swelling on left leg, difficulty to stand and walk, bruising on the forehead, nausea, X-ray done, hip fracture, hip replacement surgery, loss of appetite on IV fluid, syrup activate, asked his preference, constipation, then laxatives was given. Then on 7/7/2019, good bowel movement, refuse movement, depressed. 8/7/2019, admitted to sit on bed, physiotherapy advised, pain refused, advised to use walking stick, required home visits, disoriented, aggressive, anxiety and fears of death. Blood sugar was 420 mg per deciliter. Human ectopid increased to 18, 20 and 20. Next day what happened? Severe anxiety, mood changes, suicidal thought, loss of interest and pleasure in activities, crying, difficulty to sleep, appetite good, had full portion of offered meal, not following any exercise. So here also we have to take only those information related to the psychiatrist. We should see who is our reader. Accordingly we have to choose the informations. Then what are the management they have done? Daily dressing using antimicrobial cream, sutures to be removed after 1 week, and low sodium diet. Medication amlodipine 10 mg OD, carbamazepix 200 mg BD, paracetamol 500 mg as needed. On 10/7/2019, plan for discharge tomorrow to nursing home, Victoria. Then psychiatric consultation prior to discharge. What is the discharge plan? So advised dietary modification, medication monitoring, wound dressing and observe for signs of complications, strict exercise with use of assistive devices. Then writing task. Here this letter they are asking to write to a psychiatrist. That is the one we are going to choose in this case note. In this letter, using the information in the case note, write a letter of referral to Dr. Matthew Philip, psychiatrist, Royal Perth Hospital, Sydney, for assessment and further treatment. He visits Good Shepherd Hospital twice in a week. So, prior discharge, they are asking to visit this patient. So, then in this case, note they're making a referral to a dietitian, say a physiotherapist, psychiatrist. So, we should see what all information we have to provide for these readers. So, accordingly, we can choose that one. Okay. So, today we are going to discuss about the letter to a psychiatrist. See an example. So, the name is of the reader Dr. Matthew Philip, psychiatrist, Royal Perth Hospital, Sydney. Then the date is 10 July 2019. Salutation, dear Dr. Philip. Then reference Miss Elizabeth, aged 75. How we can write the introduction? I am writing to refer Miss Elizabeth, who has altered mental status. Then what's the requirement? She requires your further assessment and management before her discharge tomorrow. So everything is clear for him. Then we can go to the social history first. So how we can write? Miss Elizabeth is a widow and resides in Victoria Nursing Home. We informed her. Then her son has been diagnosed with Down syndrome and has a strong family history of depression, because it is mentioned there, no? The grandfather passed away depression. So there is a family history. We have to inform the psychiatrist about this one. So let's move on to the medical history. So Elizabeth has had bipolar affective disorder at the age of 30 and was treated with electroconvulsive therapy along with medications. But we have to inform him she was not compliant. So how we can write? However, she is non-compliant with her medication. Then what else she had? She had a suicidal attempt at the age of 42. She was an introvert and inferior during her childhood and had no social involvement. So we have to inform everything regarding her mental status. What happened now? On 4th July 2019, Miss Elizabeth was hospitalized following a fall. She underwent the surgery successfully and was treated conservatively. Otherwise, we can just mention there she had a hip fracture following this fall and she underwent hip replacement surgery successfully and was treated conservatively, because we are going to write the psychiatrist. No need to mention about the loss of appetite and the syrup activate on IV fluid like that. Then what else we can write? Post-operatively, she developed depression, disorientation anxiety and fear of death. Therefore, carbamazepic's 200 mg twice daily has been commenced on her. Now we can write, yesterday she was found with sobbing, crying. No, we can use synonyms. Then suicidal ideation and insomnia. She also has lost interest and pleasure in her activities. Then how we can write the recommendation? Here we can write, your effective consultation and treatment would be beneficial for Miss Elizabeth's condition. Then we can write the closing sentence. Please do contact me if you have any queries regarding Miss Elizabeth. Then yours sincerely, because the reader's name is given. The position is charge nurse. The name of the hospital, it's optional. If you want, you can put Good Shepherd Hospital. Otherwise, even though it's not mentioned, it's okay. So I think it's clear for you. And if you have further queries, you can just comment below comment box. Thank you for watching and supporting my channel, and keep watching to get more ideas. Thank you. Bye.